Cool. Good morning, everyone. First of all, a massive thank you for coming to the fourth edition of DeSci Berlin. I want to start out by saying a massive thank you actually to the organizing team, to Julia, who did such a fantastic job, Ella and everyone else. Fun fact, Ella is actually from South Africa, where Molecule first began. So kind of to make a full round trip. It's never easy opening this conference because there's so much kind of expectation that rides with it, especially as an entrepreneur. And so I always like looking back at how much we've achieved and where we need to go. DeSci Berlin has really had the honor to become like a founding ground for so many of the organizations that operate in the DeSci space today, and has had the pleasure to kind of lay parts of its culture. Fun fact: if it's who's in this building for the first time? Oh wow! Okay, almost everyone. Okay, fantastic. We had the pleasure to get into touch with the current kind of owner of the building, and so fun fact: if any of you don't know, it is a former brutalist church. That was built in the, I think in the 50s. It's also an art gallery. And so we got in touch with the owner because he was exhibiting an art piece, a very famous NFT called Machine Hallucinations, which was one of the first seminal pieces in kind of AI-enabled art as NFTs. And he auctioned it, so we got in touch with him. And this room just happened to be available. And we found it very befitting that a former church could also be the home for the future of decentralized science, especially given kind of the relationship of the church and science throughout history. So this used to be the former community prayer room or the community sermon room. Cool. Ella already introduced me, so I'm not going to join. First, to start off with, why are we here? And many of us might be also investing into crypto or have found a belief in systems like Bitcoin over time. And maybe to preface, some of you may have heard this talk previously. There are elements that kind of I repeat as I go through different talks, but it seems like many of you are also entirely new, which always makes this really, really exciting. And so people invest into crypto often because we believe in kind of sovereignty, in liberty, in open source access, and in freedom of speech. And people have begun to really believe in those things because something has been taken away from many of us, kind of slowly and silently, over the last couple of decades, or over the last decade. So Bitcoin really famously started out after the Great Financial Crisis. And after the Great Financial Crisis, a large amount of money printing began to kind of support the system as we have it. And that led to an enormous amount of inflation. So you think about it, only since 2020, inflation is mostly almost 40–50% across most Western economies. And there's very little that people can do about it, other than, for instance, decide to purchase Bitcoin, which is fundamentally based on a very different system. And so it provides an exit mechanism from a current system that people chose not to believe in anymore. And science and medicine, in my opinion, are trapped in a very similar kind of power structure that we deem too big to fail. So to take the analysis again with Bitcoin and the central bank, it was really kind of the banking industry that forced the Federal Reserve to kind of go on this permanent spree of quantitative easing. Yet with the pharma industry, for instance, and the way that the FDA functions, or the way that the patent office functions as kind of a safeguard for innovation, we're really trapped in a similar kind of power structure. Science is obviously much bigger than medicine, but here I'm just going to use the example of biopharma. Many of the organizations that we help work with are tangential to the biotech or the pharma industry. And so to take a US-centric view, biopharma, for instance, in the United States consumes about 18.5% of the US GDP. And about 9% of that is used on spending of drugs and pharmaceuticals. And it's really all entrenched by a 19th century era patent system And so these are all things like power structures that we accept. There's a very famous quote from Balaji, former CTO of Coinbase. We're also very lucky to have him as kind of an investor and supporter in many of the ecosystems that we help generate. Some of you might know him from his network state work. But so Balaji says, in order to begin, like someone had to invent Bitcoin to change any part of what the Federal Reserve was doing. I think we should take a similar approach. If someone had to invent or like think through all of the structures that are being developed in DeSci in order to actually begin changing these kind of the inherent power structures that we have today. And that's really the potential to kind of invent something entirely new. And you're gonna hear from many incredible teams that will kind of walk you through what they're inventing or some of the frameworks that they're using. What defines the current system? So in today's world, treatments and kind of recurring revenue dominate the healthcare system today. The system that we've created needs lifelong customers, and fundamentally, for instance, it disincentivizes cures. So there's a really famous article from Goldman Sachs, it was published in 2018, and the article caused such headlines because it basically asked, is curing patients a sustainable business model? And the answer of the article is obviously, it's not. The Goldman Sachs report resulted in the downgrade of a company, and I think several executives were fired at the time because a very famous pharma company had invented a cure for hepatitis C. This pharma company previously had multiple treatments on the market. Other companies also had treatments on the market. These treatments were lifelong treatments. Hepatitis C at this point was like a very damning diagnosis. You would have it all of your life and very hard to treat, massively decreases the kind of quality of life. And, but it would have been much more profitable for these companies to just keep selling treatments rather than developing a cure. And so as a company in today's ecosystem, you're punished essentially for really fundamentally solving a need. And this is something that I think massively needs to change because otherwise there's so much inefficiency. Like imagine this number, this 18.5%, it's much lower in other countries. In some countries, drug spending is like 0.5%. You can spend all of that on infrastructure, education, you can do all these amazing things. And so this fundamentally holds societies back. There's a very interesting game theoretic principle called a Schelling point. In fact, the inventor of bonding curves, some of you may have heard about systems like Pump Fun or other kind of launchpad systems. They all utilize a function called a bonding curve. And so the inventor of bonding curves, his name is Sam de la Rouvière, he defined it as a Schelling point where attention naturally accrues. So a Schelling point in game theory is a point where kind of devoid of all other options, like participants in the game go towards that option. And cures are not Schelling points in today's kind of economy. It's also why, for instance, the pharma industry is fundamentally not so interested in longevity, right? And it's been a really big debate of the longevity industry over time. Why wouldn't the FDA actually make aging, like mark aging as a disease? We could run clinical trials in a very different way. It's because it's not a Schelling point in today's economy because you don't actually want to keep people healthy, right? Because then it's very hard to sell treatments. Let's look at the other side of the equation, right? On the one side of the equation, we have patients or the beneficiaries of science. On the other side, we have scientists. And so this is a really famous quote. We actually got from the first scientist we ever worked with. And then we confirmed it over and over time. So scientists today spend 80% of their time applying for funding, 20% doing the science. Imagine if this applied in software development, right? Imagine if software developers had to spend 80% of their time like trying to get money even just to write a piece of code. So there's an enormous amount of inefficiency, again, that is wasted by essentially resource allocation problems. And it leads me personally to believe that most of the world's potential scientific talent today actually remains untapped. Like funding is really concentrated at a bunch of the major universities around the globe, around the major biotech ecosystems. If you're operating outside of that, and maybe many of you may have experienced that in your lifetime, it's extremely hard to get funding for your ideas. Like it can take up to 1 or 2 years to even hear back on a grant application, let alone try to raise biotech VC funding or any other forms of kind of commercial funding for your endeavors. In summary, unfortunately, we live in a time of science friction and not of science fiction. Like, as much as we hear about science fiction and all the cool things happening, we still live in a time of science fiction. And maybe some of you are familiar with this meme. It's a meme I personally really like. It's like, essentially, you can say, if only we did X, Y, and Z, here's what society would look like. The top is just a graph. It's a slightly outdated graph, but just about a massive decline in venture capital investments into science-based industries. That actually holds true today. Biotech, I think, is seeing one of its lowest investment records, like lowest investment periods on record in biotech. And so fundamentally, if we want the kind of the picture below, then we need to invest into science. Like it's very, very clear. But how should we invest into science? So this is from a Nature piece. I think it was late last year. So a scientist treated her own breast cancer with viruses she grew in the lab. This was published in Vaccines in August. It outlines how scientists called Halsey self-administered a treatment called oncolytic biotherapy to help treat her own stage 3 breast cancer. And she's been cancer-free now for 4 years. And it took one really brave publisher to even publish this study at all, because no one else wanted anything to do with it, even though she had all the data, because it's a very ethically flawed practice. And so even scientists who are massively pushing the envelope will kind of get buried in the current kind of establishment and in the way that science has been done to date. And give this guy a follow. He posts really good analysis. So scientist does science, she cures cancer. The science establishment, no, you can't do that. And then we wonder why scientists are fleeing academia, right? Because it's actually very hard to innovate, do new things, and be brave. Like that's not rewarded. So in summary, what we really need is permissionless science. What do I mean with permissionless science? I think especially as we go into like an age of knowledge acceleration, we need to create a system where science itself and the ownership around science can become self-sovereign, right? I've always personally really loved this idea. Imagine an idea could own itself and incentivize its own kind of, its own bringing into life. And that's often actually how tokens have worked, or tokenized ecosystems. We often ask ourselves, right, like, take a community like Dogecoin. How has Dogecoin survived over time? It's still at this point, I'm not familiar with the current valuation, but I think it's in the tens of billions. And people found it silly over time, but for some reason, this community incentivized itself into existence. And nobody owns it, just like Bitcoin. So I think applying this idea to science and essentially having scientific ideas as selling points for humanity is something really interesting to work towards. So what is DeSci? For anyone that's completely new, decentralized science is a public movement that aims to build public infrastructure for funding, creating, reviewing, crediting, storing, and disseminating scientific knowledge fairly and equitably using Web3 technology. This is a definition from 2021. I don't think it's changed much, and I actually think it's really good if definitions that are created over time actually hold true. So, also, DeSci really operates as a collaborative ecosystem. So many other organizations that are here might be working with each other. And I thought it was really interesting today to look back a little bit. In the beginning, when DeSci came about, lots of people used to do these like industry ecosystem overviews. And so I took one from 2022. This is from 2022. It was published by Ultra Rare Bio at the time, Jocelyn Pearl. Big shout out to her. The interesting thing is, so this is from 2022. There was like a really big expansion of kind of the ecosystem at the time. And then I tried to look for very current ecosystem overviews. And the difficult thing over time is like, it's actually expanded a lot, but then also it shrunk again significantly. So unfortunately, many of the organizations that are named here or that are on here do not exist anymore. And so it's actually interesting to see over time and to look at data what makes certain things work and what doesn't work. I'm really excited to say that any organization that we work with at the time is still around. And also a massive shout out to all of the entrepreneurs who like tried to do and achieve really, really difficult things. Some of them have evolved and have actually like gone fully Web3. Per Laura, for instance, big shout out to Ethan Perlstein. was one organization, if you've ever, in the rare disease space, that was really pushing the envelope already in 2018, 2019. And actually, we have had the pleasure to launch a DAO with Ethan just this year, and he'll share more about that soon. This is an ecosystem overview from 2025. It's the most recent one that I found. If anyone has a better one or a more up-to-date one, it's very much been reduced. It was published by Binance, and so Binance typically also looks at ecosystems that have an underlying token, or that might have an underlying token. Again, it is a very, very reductionist review. But it was difficult to find a very up-to-date one, and they've actually become more reductionist again over time. There was also a very large expansion of coins that we saw at the end of 2024, like a ton of meme coins. I think it's a bad overview. It's missing Wellshare. It definitely needs Wellshare. Yeah, if anyone has a better up-to-date one, it's interesting. But so it's interesting even over time if you look at the 2024 one. And this is like being a scientist, right? You want to look at your own ecosystem. You want to see what expands and how it shrinks. So what really makes things work over time? So in order to expand sustainably, and I have two more points on this. In order to expand sustainably, DeSci or organizations in DeSci or even scientists really need to work together. Like working together as an industry is so important to avoid replication. What you saw, for instance, in this part, there was a lot of replication in this. In this, there's a lot more kind of focused individual work by all of the individual players that are contributing to its success. And then with work together, there's something that I also noticed over time. It's with something that is very difficult in DeSci. It's very hard to do science. Like most scientists will probably agree, doing good science is really hard. Validating novel hypotheses, and then taking science to market is even harder. Simultaneously, working in Web3 is also really, really hard. And it's actually, and many participants would agree with this, it's gotten even harder over time. So working together is like one of the most important things that we can really do, and validating each other's frameworks. And that's not something that is so common in academia often. So something that we found over time is that many scientists or scientific founders in DeSci shy away from collaborating together and massively criticize each other constantly. Because again, like criticizing or critically analyzing is something that is very, very natural to scientific work. The second, and what I think is one of the most important pieces, is to build, scale, and refine primitives. And so primitives are kind of the cornerstone of technology, of open source, for instance, but also of crypto. Primitives are the cornerstones of that. And so there's two core primitives that we really helped shape at Bio and Molecule. And our teams later today are going to talk much more deeply about them. So one of them is tokenized IP and data. The other one are tokenized communities. Very quick recap about both of the organizations that I found and represent. Molecule is a protocol for on-chain scientific IP and data. So we turn siloed research into liquid markets powered by open data. The other side is Bio, which is a curation and liquidity launchpad for scientific communities. We bridge DeFi and DeSci and help scientists, patients, and investors collaborate to launch real-world IP portfolios and fund them. I'll give a quick anatomy of how an IP NFT works. And the interesting thing about primitives, this is a design from 2022. And yet it's outlasted, it's been used over and over again. However, we've discovered over time that it also has a lot of flaws that we're really actively refining. Kevin today is going to talk about how Molecule is like fundamentally reshaping that primitive. But at the very basis, an IP NFT is a legal contract that is attached to a smart contract. The smart contract allows you to kind of exchange the IP on chain, move it around. The legal contract essentially specifies, I am a university and I am out licensing this piece of research in exchange for X amount of funding to a contracting party. These are very normal legal contracts. Over time, we've worked with some of the best kind of law firms in the US and in Europe to essentially attach these IP rights. And then finally, you have kind of the encrypted IP and data storage part. You can kind of imagine this like a decentralized Google Drive or a data pipeline where any updates about the IP are continuously coming in. This design and this framework has also been criticized a lot over time. And so we've taken in all of that criticism and we try to really actively evolve that. The second kind of big primitive that has been developed And again, there are many primitives. These are just the ones that we know well, and the ones that we're really trying to actively work on and refine. The second one is a BioDAO. So a BioDAO is a patient community or a scientific community. It can issue a native governance token, and it can then use that governance token through input from the community to direct funding into all sorts of scientific causes. Yeah, pretty much. And what does it then do? Those scientific causes, those scientific ideas are then ledgered on chain. And what is done with that IP portfolio is now decided by that community. So the IP can be out-licensed, it can be commercialized, or it can be sold directly to consumers. So we already have multiple BioDAOs today that have discovered something and have then commercialized it and are now selling it on their own kind of websites to consumers. This only works but this only works, of course, if you're not working in something that is highly FDA regulated. What has this resulted in? So VitaDAO, really one of the most, kind of the first really DeSci organization, I think it helped massively coin the term, has funded a lot of IP NFTs already. And some of the IP NFTs have turned into IPTs. So an IP NFT is really a one-of-one representation of IP. It's like an on-chain patent, right? And an IPT is now almost a sub-DAO or a mini community around this research project driving it forward. This has actually worked quite successfully. So both the researchers at those universities received funding, science was done. I think VitaDAO itself is working on to publish multiple papers on some of the work that has been funded. Vice versa, the IPTs, I sat in a meeting about 4 weeks ago with a major government regulator and their kind of their equivalent of the FDA to get approvals for clinical trials for not one, but two of these lead compounds. And so we took something from a university, it got funded for roughly $500,000 each, and if we can progress it now to do a clinical trial, that would be massive. So despite some of these frameworks having their flaws, a lot has been accomplished over time. So let's take a big step back and look at kind of the bioprotocol ecosystem. Like, how does the demand side see this? So this is kind of taking what is being approached from a science perspective. Here we're starting to look at what is actually happening on a numbers perspective. So one of the best metrics that we found over time was really to look at the tokenized IP value in the ecosystem over time, which currently, this is a snapshot, currently sits at about 14 million. Last year, there was kind of a big excitement and kind of hype that actually brought it up to, I think, 50 million, just in the tokenized IP value. Tokenized IP for us would be would only be the two top things. And then we would account for anything that has been funded at cost. We have about 160,000 members in the different BioDAOs that we're counting now, the ones that we can see. Then ecosystem token holders is sitting at about 28,000. Yeah. This is a dashboard of all of the DAOs now that currently exist in the ecosystem. And this is so exciting to me because it's constantly more and more being added. And so this is now, like, if we actually take a step back in history, this is, where do we have BioDAOs? This is DAOs. And so these are the ones now that are continuously launching through our system. But in order for them really to scale much more, we need to fix the primitives. We need to continuously build on the primitives. So also anything that you find needs to be wrong, we really want to actively improve. And so the thing with primitives is, once built, they can be infinitely used freely and openly, but they have to be refined as shortcomings are discovered. This is so important with primitives. The second big thing, in order for DeSci to really succeed, DeSci needs to become data-driven. It's why I actually just went and tried to show a bunch of data. So we need to be much more data-driven. And then the third thing is we need to be demand-side oriented. Often, a lot of DeSci over time has tried to orientate themselves purely by like the needs of the scientists, not so much by the need of the demand side. And the demand side is two things. You need someone who benefits from the science. This can be a patient, but it can also be someone else. Right? It could be someone who benefits from a new material, or so many things, or just benefits even from like an entertainment value. I think a lot of science can be done if we focused on the entertainment value of science. Elon often says this, the funniest outcome is the most likely, and I actually think in a fully open world, the funniest science is the most likely to get funded. But so demand side orientation is incredibly important. The payer, right? In crypto, this is actually the person who puts in the money into these tokens, right? Like catering to that person is incredibly important. If we don't cater to them, we shouldn't be surprised that it's difficult to get funding. And so I ran through this. I know I'm running a little bit late. For anyone that is new to this still, actually, IPTs are kind of the last demand side primitive here. They can be exchanged for work, funding, or contributions from the demand side. I think we get a detailed case study about Vita RNA later. Kevin, you're going to give that? Awesome, cool. So I can skip through this. I just want to highlight that actually there are really, really amazing success cases being pioneered by some of the DAOs that we have to like massively enable. Kevin's also going to present this later today. This is something that we're unveiling, which is basically, this is, for instance, now purely built for the demand side, where this is kind of the new DeSci screener discovery page, where now anyone interested in all of the individual subtokens and research projects can look at the financial data, can look at how these markets are growing, but can also look deeply at the scientific data. So in the future, in the system that we're building, being a token holder in this should enable you to progressively, through access control rights, see all of the underlying scientific data. These are some of the exciting upcoming launches. We have several of our BioDAO founders also presenting and showcasing these different DAOs to you today and tomorrow. There's also an immense amount of progress coming out of the lab. And so really, really proud of one of our founders. His name is Rohan Dixon. He's building a DAO dedicated to long COVID research. So just over 2 months ago, the first patient in their inpatient study got pre-treatment blood work done. And then I think about a week later, they began treating him with a first cocktail of drugs dedicated to long COVID, dedicated to curing long COVID. It's really exciting to see these DAOs very quickly going out, doing inpatient trials, for instance, and for the first time ever, gathering data about something that kind of affects hundreds of millions. So in 2025, really as an organization, but also I think as an ecosystem, the biggest focus should be on scaling primitives. Not just our primitives, kind of any primitives that you think are really important to build in this ecosystem. That's how we get scale. And yeah, wanna really invite anyone to help. How can DeSci, like last point, we're hearing so much about AI and AI acceleration and the role of AI in science. And so scientific agents, especially like have become a really great new tool and framework for scientists. And we believe that is it's probably one of the largest accelerators for how scientific ideas and novel hypotheses can actually be natively born in DeSci. And can very quickly accelerate. So we also have a presentation from our team around bioagents that will automate core research functionalities for a lot of these scientific communities. Big shout out to Future House. If any of you have come across Future House, they've developed an amazing agentic science framework. And so about a week ago, one of their AI scientists with a lab in the loop discovered a promising new treatment for dry AMD, which is a major cause of blindness. And their agents natively discovered the hypotheses, designed experiments, analyzed data, iterated, and essentially created a whole output for this. So we want to see a future where agents can generate thousands of hypotheses, other agents rank these hypotheses, evaluate them, design experimental plans, and prioritize them. Humans can then interact with these ideas and provide key feedbacks for rewards. So I think in a future of scientific agents, having crypto-native incentives and tokenomics is actually what will massively unlock this. So in summary, we're building towards a world where scientists can spend 80% doing the science and just 20% applying for funding, and where anyone can fund and participate in science independent of institution and geography. Thank you so much.